Coming back to the United States, I need not tell the people in this room what has been happening in American medicine. I've already mentioned the growth of Medicaid and Medicare, but you all know about PSROs and HMOs and about the proposed lid to be placed on hospital costs. And this morning's newspaper carried a story that President Carter was planning to introduce into Congress a bill for national health insurance sometime in the near future. The argument is being made that all of this is necessary because there has somehow been a terrible rise in hospital costs, which the American people either cannot afford or which can somehow be eliminated by wise government bureaucrats. Most of these stories always deal with the benefits that will be received and say nothing about who is going to pay the cost. There is only one source from which the costs can be paid, and that is the American people. The only question is whether they are going to be mediated through bureaucrats with a substantial discount being taken off for cash, or whether they are going to be spent directly by people on their own behalf. So far as the rise in hospital costs, part of it is undesirable and unnecessary. Part of the rise in hospital costs has been a result of the expansion of governmental spending on Medicare and Medicaid, with the result of the many scandals that we have had in this area, and with upward pressure on prices. But in the main, the rise in hospital costs reflects primarily the decisions on the part of millions of American citizens about what they want to buy. It reflects one of the great American innovations, the spread of voluntary, private, hospital and health insurance among the population at large. The major reason for the rise in costs per day of hospital care is not a rise in prices in excess of inflation, not at all. The major reason is an increase in the number and the variety and the complexity of the procedures that are being used, of the tests that are being made, of the services that are being rendered to the American citizen. The costs of hospital care have been going up for exactly the same reason that the amount of monies being spent on automobiles went up during the 19th and 20s and 30s. Because in the main, the public at large has wanted to buy more medical care. And the market has been responding to their demands. The costs have not been rising primarily because hospitals are inefficient. I have no doubt they are. But they've been inefficient all along. There's been no great increase in their inefficiency. The costs of medical care have not been rising because physicians are grasping. Of course, physicians are grasping. So are all of us. We're all of us greedy. But they haven't become more grasping and more greedy. No, the main reason for the rise in costs is because there has been pressure to expand services and provide a different variety. Now, maybe customers have been silly. Maybe they've been foolish in wasting their money in various directions. But I think one of the freedoms we still ought to preserve in this country is the freedom for people to be foolish with their own money. Now the question is, what is the answer? In the first place, is there any role for government in the medical care field at all? In my opinion, there is no special role for government in the medical care field, with the exception of the public health activities of government where there is a special problem. But I'm now talking about private medical care, about medical care of individuals. I believe there is no special role for government in the medical care field at all.